Hello, and welcome to this podcast where we aim to discuss the pending publication by CQC of the number of deaths that were directly a cause of or suspected of being confirmed with COVID-19. So my name is Leah Cooke and I'm the Customer and Policy Lead for QCS. I'm a registered nurse with a career experience with residential care, and I'm also a specialist advisor for CQC. And I'm joined today by the Scottish Care Lead, Senga Currie. Hello, Senga.
Good afternoon, Leah. Thank you very much for the invite. Very happy to be here.
Brilliant. So our hope from this podcast really is just to share the experience of Scotland that hopefully can alleviate some of the fears and the anxieties that we know providers are feeling right now. So we're really, really lucky that you're able to speak with us, Senga, today, because Scotland released their data on the 26th of May, didn't they? And did they follow a similar process as that of the CQC? And what did their data show?
Well, whilst I'm sure that there will be similar themes in both reports pertaining to those that lost their life from COVID in care homes, the Scottish report didn't actually report on the individual care home death rates. Although it's true to say that this was done during the peak of the pandemic by the media, as all this information, it's already available to the public via the National Records for Scotland. So the report was around between the time of the 16th of March 2020 until the 31st of March 2021. So the data they looked at was within this period. And during this period, the Care Inspectorate in Scotland received 3,774 notifications of death relating to COVID within care homes. Nearly 98% of these deaths were in care homes for older people. So the statistical report highlighted trends such as the size of the care home. So the data highlighted that as the size of the care home increased, so too did the rate of COVID-related deaths. And they measured that per 100,000 places. So for example, in care homes that had up to 20 places within their home, the death rate was 2.1. However, this rose to 12.6 deaths per 100 places in care homes with more than 80 places. Personally, I think that this is understandable. As we all know, it was a highly contagious virus. And to me, if there are more people having close contact within your environment, then there would be a higher infection rate. And also, we know that trying to encourage people to socially distance when they have some degree of cognitive impairment can be a challenge. So for me, this comparison, although sad and awful as it is, really isn't surprising. The other trend that they looked at was urban versus rural care homes. So in looking at that data, care homes located in the most populated areas had higher death rates of COVID compared to those that lived in remote villages. And the numbers that correlate to that were roughly 12 people per 100 places lost their lives in homes in large urban areas, compared with 4 per 100 places in small remote towns or villages. What did surprise me and several of the providers that I have spoken to is it actually showed no correlation when comparing the quality grades of each care home prior to the pandemic occurring. So in Scotland, as I'm sure you know, we have grades 1 to 6, with 1 being the poorest and 6 being rated as excellent. So there was absolutely, when they looked at the death rates, there wasn't a higher death rates in care homes with lower quality grades. I think everyone was surprised with that.
Yeah, definitely. I mean, you've made some really valid points about the size of the care home and the findings, the correlation there with data. And there's no real surprises about the rural versus urban findings, but actually, really, really interesting to hear that the data on the relationship between ratings and COVID-19 deaths, because actually for some, this might be a reassurance for those that are managing services or working through trying to improve their services that have ratings and are fearful for any additional surprises when they do release this data. So very, very interesting. So, what was the feeling from Scottish providers then when they were informed before the data was released that this was going to be happening? This was a move that the care inspectorate would be doing?
Well, in speaking with various providers, there were concerns that they would experience a blame culture from the public. They were already feeling very vulnerable under the strain of losing so many of their residents in such a short period of time. And added to that, the fear experienced the staff. Staff experienced various levels of fear. They were terrified it would bring the virus into the care home. They were scared they would take the virus home to their loved ones. And they were scared that they would contract the virus themselves. So, in fact, there was certainly concern that when the report was released, it would be all the fault of the care home providers.
Yeah, absolutely. So real similar feelings that are aligning to right now as to how providers in England are feeling. And did you find that there was an increase in media attention for services that may have had spikes in data during the time? And if so, how did providers manage this?
There was absolutely, indeed, there was increased media attention. As I've mentioned previously, that the data is there for anyone to see, because this was reported on a daily basis to the care inspectorate, who in turn gave it to the National Records of Scotland. So there, at most nights, you would see things on the television where the media were camped outside care homes that had a high death rate with people that had COVID. It caused great anxiety amongst the staff, and speaking with some staff, they really felt guilty about saying that they worked in that care home when they were out in their local community and their shops, and it really was quite sad when they were doing their best to look after people. What was happening to me, I'm not saying previously providers didn't support staff, but I think they really tried their best to support staff's well-being by providing sessions to allow them to speak about their experiences, their fears, their anxieties. Personally, I heard of things such as massage sessions, mindfulness, and discussions around coping skills to help give staff the tools to help them cope. Providers asked for more explanation when the report was released, because the report is called a statistical report, so it was all statistics. But, for example, to explain fully why older people care homes would have a higher death rate than, say, care homes for adults or younger people. So the report didn't look at things like comorbidities, which would expose one cohort of people against a healthier cohort of people, for example. With the urban-rural stat, again, no explanation of this statistic. Such, again, as I've said before, it is such a highly contagious virus And it's obviously going to spread more easily with large groups of people. So in rural communities where people are more spaced out, it's obviously going to be lower. And in fact, out with the care home setting, this has been the case. In Scotland, for example, excuse me, Highlands and Islands have had a much, much lower rate of infection and of resulting deaths than, say, a big city like Glasgow or Edinburgh. So I think it's fair to say that providers would have liked more explanation for the public to explain the possible causes for these high rates.
It's a really valid point, Senga, because providers right now are so nervous that the release of this data could directly impact service users and their families, and potentially, maybe want people to move out of a service based on this release of data. So, what reassurance can you give from your experience that who's already been through this? Was this a finding?
Well, it's true to say that there were some people wanting to move out. But in my experience from speaking to my colleagues in the community, this indeed was minimal, very minimal. Most people were confident that the staff and the management were doing their best to protect their loved ones. It was such an unprecedented occurrence. None of us, I certainly haven't in my lifetime, experienced anything like this. The government and esteemed scientists, they were learning as it was occurring as well. So nobody had all the answers. Hindsight is a wonderful thing. You hear people saying maybe if we'd locked down earlier, maybe if we didn't allow transfers of people from hospitals or their home, maybe if we stopped visiting earlier, things would have been less traumatic. But nobody knew about the beginning.
Yeah, absolutely. And this is really reassuring to hear that the majority of people held and kept their trust in the service, which is great. And you are so right about hindsight. So how do Scottish providers now feel about the release of the data?
Well, as I mentioned earlier, they're okay about the statistics being released, but they feel only half a story has been told, and they would just like further explanations of these statistics to help people that aren't working in the field understand the reasons behind that.
Yeah, absolutely. And I guess we really need to be mindful that providers may have lost staff members due to COVID. So how did providers support staff during the time of the release and the following weeks?
Oh, absolutely. I know of providers who've sadly lost staff to the virus. And this has not only had an awful impact on the staff member's family, but also to the other staff and the residents within their service, because it's just like one big family. One care home manager told me, and I thought this was just wonderful. She told me of holding a memorial service for the staff member that had passed, invited her family, and they gave thanks and gratitude for her help during the pandemic. And she says that it actually helped staff and the family. And they were very appreciative that their loved one that was lost was acknowledged. So the feedback I've received from the corporates has been that inquiries for places has gone down roughly about 15%. So it maybe is that people are afraid to go and live in a communal group setting. But we don't know that for sure, because maybe it's an enhanced community package that's supporting them to live longer at home. So whilst recruitment was always a challenge in the sector, it always has been since I came into the sector many moons ago, it's felt that this COVID pandemic had a huge impact as trying to encourage people to come into care is even more difficult. But again, it's hard to know if it was that, or if we've also had Brexit, so getting overseas staff is difficult now. So it's difficult to know exactly what the experiences relate to.
Yeah, absolutely, and certainly something we need to be watching very closely as we move into the other end of the year. So this kind of concludes our podcast, really. Just to finish off, we do have a number of resources that can support you to prepare for the release of the data. And that includes a manager's guide to managing media inquiries. So please, if you haven't already, head over to our website for further details. So thank you so much, Senga, for your time and your input and the expertise that you can offer to hopefully just make providers more aware and provide some reassurance.
You're welcome. Bye-bye, Leah.
Bye-bye. Thank you.